One of the keys to success in root canal therapy, a procedure in which the nerve and pulp of a tooth are removed, is to be able to determine the correct endpoint of the root canal. The recommended point is the physiological apical foramen, also called the apical constriction. Normally, however, this is not a fixed or defined point, but rather a distance from the radiographic apex. Depending on the methodology used, determining exactly where this desired stopping point is located can be difficult. COLTENE's CanalPro Apex Locator solves this problem, providing an accurate way to obtain correct results in canals, whether they have wet or dry conditions. The CanalPro Apex Locator is an electronic device used for apex localization and for determining the working length, i.e., the distance between the cusp tip and an apical reference point during root canal treatment. CanalPro is highly accurate, providing the reliable, spot-on performance that will make it your go-to unit for apex locating. CanalPro's accuracy comes from its use of endometry to determine the working length. Other methods that can be used to determine the working length are X-ray and tactile determination. Each of these other methods has some serious drawbacks. Although X-rays are the most commonly used technique, since the apical constriction is not exactly visible on the two-dimensional X-ray image, it is simply assumed to be located 1 to 2 millimeters away from the radiographic apex. The working length is then determined based on that assumption. When these assumptions don't hold true, over-instrumentation can take place. On the other hand, tactile determination uses a root canal instrument to touch or find the apical constriction. Because success with this method requires a great deal of experience and sensitivity, using only this method is now considered obsolete. In contrast, the CanalPro Apex Locator uses two measuring frequencies to accurately determine the apex location, and it calculates the working length using electrical resistance measuring. Unlike other apex locators, CanalPro alternates these two frequencies rather than mixing them. This eliminates noise and the need for signal filtering. In addition, it uses signal intensity to calculate the file tip position, making the measurement immune to electromagnetic interference. The CanalPro Apex Locator gives you an easy-to-use interface that shows you the movement of the file inside the canal from the beginning of the procedure to the end, giving you the uninterrupted feedback you need for an excellent end result. The CanalPro Apex Locator is not recommended for use in patients who have a pacemaker or other implanted electrical devices and can only be used with stainless steel or nickel titanium endodontic files. To use the CanalPro Apex Locator, simply connect the cables and attachments to the device, attach the lip clip to the patient, insert the endodontic file into the canal, and connect the file clip to the file. An image of the file inside the tooth will appear on the high-resolution 3D full-color display screen. At this point, you'll be able to see the movement of the file inside the canal on the left side of the display and an enlarged root canal image on the right. Large numbers will show at the bottom of the screen to indicate how close the file is to the apical constriction. As the file gets closer to the apex, the colors in the right-hand image will begin to change. For most root canals, you'll want to stop when you reach the area indicated by 3 green bars, which is the apical constriction area. For inflammation cases where the pus has to be transported upwards through the canal, you can carefully keep going until the word apex appears. If you go too far, a red blood drop will show to indicate that the file has passed the apex. In addition to these visual cues, the CanalPro Apex Locator also provides audio feedback of the file progression in the form of progressive rate beeps. When the apex is reached, the beeps change to a solid tone. If the apex is passed, you'll hear a warning sound. In addition, before you insert the file into the canal, You can tell the CanalPro apex locator how far from the apex you want to stop. This predetermined position will then be marked on the image on the screen, and you'll get a clear visual and audio notification when the file tip reaches the selected mark. In conclusion, the CanalPro Apex Locator from COLTENE is an electronic device used for accurate apex localization and working length determination during root canal treatment, thereby reducing the amount of time and number of X-rays needed to achieve an accurate root canal treatment. It's an intuitive, ergonomic device with an animated color display and audio feedback that notifies you when your endodontic file reaches the apical constriction of the root canal.